My name is Dr. Ursula Jacob. I'm a general practitioner trained in oncology and immunology. I'm based in Munich in Germany, Zurich in Switzerland and in Dubai. As a doctor as well as involved in the scientific field. I know RGCC since more than 20 years. I know Dr. Papasiteriou since this time, and I use the RGCC services already because RGCC was one of the first company who developed microimmune therapies, also the testing for chemosensitivity and the isolation of tumor cells. And this is why I used the services for these kind of years during I worked as an oncologist, but as well now in concentrating on autoimmune diseases, immune problems, chronic inflammation. So this is one big part of our diagnostics, what we need to know, that we can figure out risk factors for patients for now and for the future, mainly risk factors for developing cancer, or if they had cancer, how to protect them in a good way. And together with the therapies that offered from RGCC, which are individualized, we can offer a very good program for the patients. I'm using from the diagnostics, the oncotrace tests, or as well the chemosensitivity tests if it comes to cancer patients, but I'm using as well the therapies RGCC is offering, like SOT or like VEXUQ-REC, what is going to the immune system of the patient, or we're using as well these therapies like dendritic cells or regenerative therapies dependent on the outcome of the tests we're doing with RGCC, like for example Biocentaur test, where we test different viruses what are involved that cancer can come. And if they find something like that, the beauty on these tests is that we get as well mutations tested what are already in the cells through the viruses. So we can know exactly, is the patient getting or is involved in an autoimmune disease, can he get cancer, and then accordingly to the test outcome, we can treat them with SOT, for example, or with dendritic cells, dependent on the results of the test. So we can treat diseases now or also avoid for them diseases in the future. When you ask me about success stories, I have a lot of success stories. But I can tell my success story for my person itself, because during the time I know RGCC and Dr. Papasiteriou, I developed a rectal cancer for several reasons. So the detection of the rectal cancer was through RGCC, because I haven't felt very well, so I haven't thought that I have that. So we did the oncotrace, and in the oncotrace we found that I have cancer cells, and then PET scan, other diagnostics, we found rectal cancer in an early stage. So I used the tissue of the rectal cancer for producing dendritic cell vaccinations with RGCC, and this is what I was doing, this kind of therapy. And I did a specific immunotherapy, what I tested as well. This was around 10 years ago, and up to now I'm monitoring myself with oncotrace, with the immune testings we can do, with very important Biocentaur test, because as one of the causes for my cancer we found Epstein-Barr virus. Epstein-Barr virus is involved in a lot of cancers, not only in lymphatic malignancies, also, as the study shows now, in solid cancers, rectal cancer, breast cancer, pancreatic cancer, gastric cancer. And this is the reason why, for my own sake and for the sake of my patients, I'm using these tests and therapies. I can say from the point where what is scientific based and from the kind of diagnostics what can be done nowadays in these called liquid biopsies, RGCC is most advanced for several reasons. First, scientific based, they publish a lot. Second, they are using a lot of different tools for the diagnostics, not only 1 or 2 or 3 markers like other labs. They're using only 3 markers for detecting possible cancer cells out of the blood. And these markers, and I'm involved in research about viruses, I'm in a scientific circle about that, these markers are used or produced from viruses as well. So you cannot detect over these 3 or 4 markers if it's cancer or if it's a viral-based chronic inflammation. We need more of these. And RGCC offers minimum 30 markers or more detailed, and now with a new development that they offer also to measure genes concerning cancer, we get an exact idea if it is viral-based, chronic inflammatory-based, or if really already the cancer stage is reached. And this is what I like in this company. The RGCC group, what I know now really since more than 20 years, developed very good. And I have to say, the people working there, they are very fast in answering things. The people around are really good enough and they are trained well enough that they can answer my questions. And the cooperation is very good on a short way, or when you ask something for specific diagnostics, or when you want to have an interpretation about something and you ask the different people responsible for that, they are answering within 2 hours. And this is what I like as well, because we need these answers to develop our clinical therapies out of that. And this is something what is really reliable in RGCC, and the test results we get back in a short time. It's horrible when you wait 3 to 4 weeks for get back a test result. So within latest 10 days we have from the Biocentaur the viral tests back and the mutation tests, and Oncotrace, or also the tests for chemosensitivity you get within 10 days back. And this is a sufficient time to also for the patient to interpret it for the patient and to get the therapeutical benefits out of that. What I would suggest from my point, where I'm working since really long time with immunologists together, groups of scientists working with RGCC, I think what is already there, but what probably could develop a little more, is how the immune system is connected to the viruses, what they do in Biocentaur, or to the cancer cells. Because we know nowadays, and this is what they start new, that for example microbiome of the bowels is connected to the immune system very close and is connected to cancer. They start now to do that. I know from the logistics it's not very easy to bring it together, but from the educational session I think we could intensify a little more the communication between the researchers and the clinicians. And this is what I have to say, it's good here. When I see the group of people sitting here and listening, there are researchers, there are a lot of doctors using that, and the communication between the lab and the biologists and scientists and doctors is tried from RGCC to keep it close, because in a lot of cases this is not working. The lab doctors are not talking to the clinicians. And this is something what RGCC tries and makes good, and it improved the last years. This is what I can see from the last gatherings. And this is how it should be, because there is so many new things going on, and collecting the data from everywhere, it's something hard, sometimes hard as a doctor. But when you get it all together in some of these gatherings, this is perfect. And this could be probably connected a little more intense, but I'm sure in the next few years this will work out in a very good way. In these annual meetings, for me, the most interesting part is to learn about new things, like this year, about new tests, because look, the diagnostics are developing all the time. And as a doctor, and we swear that we want the optimum for our patients, we need to educate ourselves independent, how old we are, independent, what stage we achieved in our education. And so I learn about new tests. I'm meeting interesting people to exchange knowledge and to make cooperation partners. And what I'm very happy about is that I see an increased number of interesting doctors compared to the last years what are interested in these services. Doctors who are working in their field for a lot of years who realized that we need different therapies and diagnostics. And nowadays we have the chance to go ahead before cancer is coming with this kind of tests and this kind of individual therapies, what RGCC is offering. And the best in RGCC is it not only offers individualized diagnostics, we have an outcome for the patients from the therapies. And this is what I like, because only hearing about diagnostics and tell the patient you have a problem, you can get cancer, and they ask you, doctor, what I will do now. You cannot say wait and see, like it is in oncology. Still, normal, what I don't like at all. So we can offer really sophisticated data-based and research-based therapies for them, because all what RGCC is doing is research-based, they're publishing, and they have really the therapies based on these as well. It's not something from the air, it's something what is based on scientific research.